Is your Medicare supplement premium going up, 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 and you want to switch, but you're worried about losing your doctors? Well, you are not alone, because here at NJ Life and Health, we have helped thousands of people switch their Medicare supplements, and the biggest question they always have is, will I be able to keep my doctors? Now, we know the answer is yes. Medicare supplements are standardized by the federal government, so there can be no changes if you were to switch between Medicare supplements to your doctor's network. But the question still remains, it's still very front of mind. So rather than just show you the exact law and the exact verbiage on Medicare.gov, I created a little exercise that I do with my clients in Toms River in person, and I'm hoping to replicate that for you here via this YouTube video. So I hope you guys enjoy. If you're interested in switching your Medicare supplement, you can reach out to NJ Life and Health, 848-226-6897. More on that at the end of the video, but now let's dive into this little exercise to explain how Medicare works and how your Medicare supplement works. So for starters, you have a red, white, and blue Medicare card. It's a little grainy. It's coming from the official Medicare website, but that is a pretty low quality photo for whatever reason. But let's explain how original Medicare works. So we have a couple big bullet points for you here, because I think a lot of people think that their Medicare supplement is doing all the heavy lifting, but really, original Medicare is your red, white, and blue Medicare card. So as of 2023, 98.9% of doctors accept original Medicare. That means that with a fairly high certainty, you can see pretty much anybody you want to see. It's obviously not everybody, but a very, very high percentage. So a lot of people think, hey, company A lets me see all these doctors. No, it is original Medicare. On top of that, original Medicare determines what procedures are covered. If you ever want to see specifics, if you ever want to search your particular procedure you need, you can check Medicare.gov, but by and large, anything medically necessary in a hospital medical center is going to be deemed okay. On top of that, there's very little in the way of prior authorizations. People love original Medicare because there isn't a lot of pushback for the procedures that they need. So not only do most doctors take it, not only are most things covered by it, but also they don't give a lot of hassle to the doctors who need these things. And on top of that, it's going to cover about 80% of your medical costs. So it is a little more complicated than this, and there are other videos we could show you where we go into the very specific numbers and everything, but for the sake of a very simple video, we're going to just say 80% of your medical costs. If you want more info, go to Medicare.gov, call us, check some of our other videos. But just to recap here, 98.9% of doctors, they're determining what you can get. They are telling doctors, we're not going to fight too much if you need things approved for your patients, and they're going to cover about 80%. As you can see, the Medicare supplement hasn't even been added to the equation yet. This is your front line. This is doing the vast majority of the work, and this is really your rock. This is steady. So now we have your Medicare supplement. Let's bring up the talking points for that. So this is just a Plan G. This could be any Medicare supplement, but we're going to use Plan G as an example because it's so popular. You have a Plan G from Company A, who is a popular company. Well, they're going to cover the other 20% of original Medicare coinsurance. We talked about original Medicare covering the 80. They are going to cover the other 20% of original Medicare coinsurance. We talk about 80% of your costs getting absorbed by original Medicare. A Plan G by law has to cover the other 20%. Now, again, it's much more complicated. We could go more in depth into the other Medigaps, but they're going to cover all of your Part A hospital deductibles and copays. They're also going to cover your Part B copays. They're going to cover Medicare excess charges. All you're responsible for in any Part A or Part B situation is a $257 out-of-pocket deductible for Part B. So this is all Plan Gs. They have this. And just so you know, any Medicare supplement has to approve anything original Medicare does. They don't have a choice. There is no other company or anything like that. These aren't company specific. I could show you the Medicare website, but I'm just trying to get this through to you guys that the company truly does not matter. So just to recap, we have original Medicare, your front line, determining your doctors, what procedures can get done, and having very little prior authorizations, as well as covering 80% of your medical costs. And then for company A, their Plan G, which is standardized by the federal government, is going to cover the other 20% of Part B coinsurance. Now, let's say you're paying $275 a month for this Plan G. This does vary a lot depending on the state, but just so you know, we're looking at $275 a month. You might be thinking, well, this is just the cost of good insurance. This is what I have to deal with. What if I come to you as a Medicare broker and say, hey, you're paying $275 a month for a Plan G. What if I got you a Plan G for $150 a month? Well, your first thought is going to be, well, do they take my doctors? And my point again is it doesn't matter. If you were to switch from company A to company B, you still have everything the same. These are identical products. It is very hard for people to understand and process because it goes totally counter to everything we know about health insurance. But it is true. These both have the same exact benefits. The only difference is the price. So let's do a quick example here. Let's say you're in this $275 a month Plan G, and the brokers here at NJ Life and Health switch you to a different Plan G, the one with Company B we've been talking about. Nothing has changed in relation to your doctors and in relation to the procedures you can see, in relation to the very little prior authorizations, and in relation to the 80% of the medical costs. You just now have a lower monthly premium for your Plan G, and everything is identical. So I always want to show this to people. I usually do this with cards in front of my desk, but this is the best way to do it digitally. We can switch stuff all the time back here, and Medicare stays the same. This is still what you give your doctor. We can even take this a step further. What if in a couple years this goes up again and you want a Plan N? Well, now we got a Plan N here, and this is still the same. The doctors haven't changed. So what I do is I literally just shuffle all these cards behind somebody's Medicare card to show that it doesn't matter what Medicare supplement you have. Your doctors will always be the same. The procedures you can get will always be the same. The authorizations will stay low, and the 80% of your medical costs will still be covered. So don't be afraid to switch Medicare supplements. Right here, this example, switching from company A to company B, it's about $1,500 a year. If you're a couple and you're both saving $1,500 a year, that is big money. And like we said, you are still seeing the same doctors. Just so you know, if you're in a state like New Jersey, or some other examples are like Pennsylvania, Florida, North Carolina, South Carolina, you can actually switch Medicare supplements year-round, provided you're healthy enough. So as long as you don't have any surgeries on the horizon, you don't have any severe chronic conditions like dementia or ALS or something like that, you should be able to switch with a fairly high degree of certainty, and you don't have to wait until the end of the year. We switch people all the time in March, June, August, all over the place, because these are year-round switches. They are not tied to the annual enrollment period, which is probably the biggest myth associated with these plans. Now, if you want to work with Medicare brokers that you know and trust, you should work with us here at NJ Life and Health. We have helped thousands of people across 29 states, but New Jersey is our home. We're based in Toms River. And if you want your free one-on-one call to see if it makes sense for you to switch Medigaps, if it makes sense for you to look into a different Medicare Advantage plan, whatever it might be, any Medicare question you have, just call us at 848-226-6897 or visit our website at www.njlifeandhealth.com. Our team of brokers is here for you whenever, all year long, and we are happy to help you out with whatever questions you have. Now, did you like this video? Are you still worried about losing your doctors if you switch Medicare supplements? What other videos would you have? Please like and subscribe if you love this Medicare-related content. Leave us a comment down below on your thoughts on the video and if you have any more questions. And once again, reach out to us if you have any questions directly. We are happy to make you one of our clients. So please like, subscribe, leave a comment, and we will see you in the next video.